webinar. Your feedback indicated that you would like for us to go into more detail around outcomes, so we are very fortunate to have Elizabeth Cleek from ICL and Julie Gutowski from Spectrum Human Services return today and present to you today's webinar, which is Outcome Measurement and Clinical Support Tools Part 2. Before we begin, I'd like to go over a few things. Currently, all participants are muted. So we're going to ask for you to type any questions you have throughout the webinar in the chat box to the right. We will answer your questions if possible during the webinar, and if not, we will answer them during our Q&A period at the end of the webinar. There will be one polling question that I will introduce, and you will answer the questions in the poll box, which is also in that same box as your chat. So over to the right is where the polling question will appear. When the webinar ends, or you leave the webinar, there will be a feedback survey which we ask that you complete so that we can continue to improve our webinar experience for you. The webinar recordings and slides will be posted on our ctacny.com website either later today or tomorrow. So let's get started. We are very happy to have today's presenters return and grateful to them for sharing their expertise with us around outcome measurement, which is, as you know, becoming more important in our work with our clients. Welcome, Elizabeth and Julie.
Thank you, Kara. I'm going to get us started off. I'm Elizabeth Cleek. I'm the Vice President for Program Design, Evaluation, and Systems Implementation at the Institute for Community Living, and also on the CTAC BEEP and BEAM leadership teams. And essentially, the Program Design, Evaluation, and Systems Implementation Department supports implementation of evidence-based and best practices, as well as the agency's effort at documenting and using outcomes to inform the work that we do. And so that's sort of the perspective that I'm bringing today. And what we're going to cover, I'm very excited to be presenting along with Julie Gutowski, and we're going to be covering essentially how outcomes can be used to both to help guide treatment, thinking about the impact of outcome measures, how they can be used in different ways, how to use them effectively, some commonly used tools. And then Julie is going to take us through the MAP program, Managing and Adapting Practice, which is something that we'll be bringing through CTAC and are looking forward to folks joining in on. And then, of course, next steps. So with that, I am actually going to turn it over to Julie.
Hi, everyone. I'm Julie Gutowski. I'm Managing Director of Clinical Operations in Western New York for Spectrum Human Service. We're an outpatient, not-for-profit. We do chemical dependency and mental health treatment, and my job is to make sure that the services we're providing are done in a cost-effective manner using evidence-based practices and really looking at the outcomes. So for me, like Elizabeth, today's topic is very important to what I do every day. One of the reasons to focus on outcome measurements and clinical support tools really is because it can help you guide treatment for both the individual or the client and also the clinic. I can give you an example of how using an outcome measure was helpful when I was working with somebody in clinic. I was working with Tiffany. She was a 16-year-old girl with anxiety and depression. And I had been working with her for approximately a year. When she first came in to see me, she had very high anxiety and depression, and she had ongoing suicidal ideation pretty much all day, every day. And so I worked with Tiffany, and I did the usual interventions, and I was measuring how she felt things were going in her life, and I was using my outcome measurement tools as we were going on in practice. And at one point, it felt like Tiffany didn't feel she were making any progress. And so because we have used the outcome measures, and I had explained to her at the beginning the purpose of using the measures and why we would be using the measures, I went right back to the measures, and Tiffany and I would have discussions about you know, the typical clinical discussions. How will you know when you're feeling less depressed? How will you know when you're feeling less anxious? And so we worked on that. And then I used the tool really to allow her to gain some insight, because one of the things we really looked at with Tiffany is how frequent and intense her suicidal ideations were. And so even though she was still experiencing them on a daily basis, she was experiencing them far less frequently, and so instead of it being kind of an all-day, everyday thing, it really got down to maybe a half an hour that she would be experiencing that. And so because of using the outcome measures in the context of our clinical work, it was really helpful for her to understand the progress that she made. Why is it important, and how can it guide treatments for the clinic? It can assist the clinic and the clinician to provide better care for clients. So you really get a good understanding of the person's symptoms or what they hope to accomplish in being in treatment, and then you're able to continue to measure against that. I kind of think of it like if I were to go on a diet. If I make a determination that I want to lose 20 pounds, I can weigh myself on day one, and I'll periodically weigh myself to see how close I am to my target. But if I decided I just want to lose weight and I don't have a way to measure, or I don't have anything that's going to help me assist to understand how close I'm getting to what I want, it can be a little bit disheartening and feel like I'm on a wild goose chase. It also can help you understand and help the clinician understand the needs and the progress of clients, like I spoke with you of Tiffany. That's on an individual level. You can also look at your entire caseload, and if you're using outcome measures, to see if the interventions that you're using for anxiety, whether it's truly being effective not only for each specific client, but also as your caseload as a whole. To assure that clients are meeting the goals and objectives, and that we're really working with people to understand what they want to accomplish. And this, I think, is really important for me in understanding the termination of clients, using outcome measures and clinical support tools really to help you understand when is it time to successfully complete the client. I know in the past perhaps we didn't, as a field, focus so much on what is discharge going to look like, what does the client need to see, experience, or feel, and what do I, as the therapist, need to see and see from the client's perspective in order to know that they're ready to complete treatment. And using the outcome measures can really give you that concrete understanding. So you're better able to make solid clinical decisions, and people know how far they are towards achieving all of their goals. And I think you can also use it for viewing the overall success of the treatment, such as if you look at your caseload and you have out of, let's say, 80 people in your caseload, 25 of which have an anxiety diagnosis. Are the clinical interventions you're using effective, and how would you know that? Well, you could use an outcome measure that will tell you whether each individual client is getting better, and then you could look at, of all the 25 people with anxiety, how many of those seem to be getting better, and do you need to look at your clinical interventions or your approach, or maybe attend a training? I think the role of outcome measurement really is helpful in establishing target symptoms at baseline, again, and over time. It can help you demonstrate the change, and so the person gets a visual understanding of how far they've come and where they need to go in order to meet the goals. I think it's important to also use it as a part of psychoeducation for the client and the family, so people understand and really get a good knowledge and framework in terms of their symptoms and some things that they can do which will make their life better, improve the quality of their work. You can also use outcome measurements in terms of utilization review, supervisors, and also for payers as we continue to move into the managed Medicaid and also private insurance. And managed insurance, it's going to be more and more important for us to really demonstrate that we are, and the services we're providing, are having a positive effect on the clients we're serving. And again, at an aggregate level, so if I were a clinic supervisor, I would not only want to know what is the successful completion rate, for each specific clinician who's working with me in the clinic, but also as the clinic as a whole. You can really look at the successful completion rates. Do people seem to be getting better? Are their symptoms decreasing? Is the quality of their life increasing? Is there, one thing you might look at would be similar to a gap. So is their functioning increasing based on the interventions that we're using? And then it's really important to look at the impact of outcome measures. Treatment. Are you really adapting treatment to meet the specific needs of each client, or do we have a little bag of tricks that we seem to always pull out of when we're treating with somebody with a specific diagnosis? Individual, you're really going to look at the show rates and the improvement of the person's mental health. You can look at whether they're experiencing a decrease in symptoms, and if they're not, what interventions do you need to do differently, or what different interventions might be helpful. And then the impact of outcome measures on a clinic. You can have improved clinical outcomes and productivity. So for me, it's really important, although I know we're all in the field because we want to help people, and we like to talk and really hear what our client or our individual is saying to us. I think that's really important, and I think the use of outcome measures or clinical support tools can really help to make us better at listening to where our clients are coming from, what are their needs, and what are they feeling has been helpful for them.
Thanks, Julie. We now have a polling question for everyone. We want to know how your clinic uses outcome measures. So over to the right, you're going to see the questions and the answers. So the following statement best describes how my clinic uses outcome measures. A, we are interested in using outcome measures but don't know where to start. B, we use some outcome measures but not in any consistent way. And C, we consistently use outcome measures but we aren't sure of their effectiveness. And D, we consistently use outcome measures and have seen an increase in production and understand them to be effective. So you'll choose one of those statements that best describe how your clinic uses outcome measures. You click over to the right, A, B, C, or D, and then click Submit. I'm just going to wait 1 second for the results. We just want to check in with everybody on the webinar today to just see how your clinic uses outcome measures. And it seems as though, do we have the results? So it seems as though you've answered mostly B or D. Okay. Oh, no answer. No, mostly B or no answer. So it seems like most of you use some outcome measures, but not in any consistent way. That was the most answers. 14 of you answered that way. And then D, actually only 2 of you answered that you consistently use outcome measures and have seen an increase in production and understand them to be effective. So thank you for participating. That's really helpful to understand where you're coming from.
Okay. So thinking about outcome measures, and especially for those who said they're interested in outcome measures but aren't sure where to start, the first really important thing is understanding and really clarifying what you want to assess and what you're looking to achieve. So with an outcomes tool, you want to identify if you're trying to capture something global around the types of symptoms that most people are coming into your clinic with, or diagnostic specific. So different people are going to get different outcomes measures according to diagnosis or specific symptomatology. Or if you're really thinking about functional improvements and you want to see a demonstrable change in a person's routine, or something else altogether. The key at the outset is to really identify what it is that you want to capture and you want to look at, and then choose your tool accordingly. You're looking at it to see, does it assess what I want it to assess? Does it measure what I'm looking to measure? And is that confirmed by the research? And so I think for outcomes tools, you really want something that has face validity. You want it to look like what it is. You want to be able to have a conversation with the client sitting in front of you and have the client understand that they're giving you feedback about their symptoms. They're documenting how they're feeling. And so it should look like what it's supposed to look like. It should look like what it's measuring. But you also want it to have been through a research process so that it's been validated and it's been proven to be reliable, or to measure the same thing over time. Also, you want to look at where else it's been used. Has it been used in an outpatient mental health setting? Has it been used in a similar type of program? Some tools are really sensitive to change. Some tools are specifically developed to track outcomes and to track change over time. And others have different uses. Some might be used to help confirm a diagnosis, to rule out information, or to rule in. And so you really, again, you want to think about what the tool you're looking at, and the first step is really selecting the tool for quality and appropriateness. Okay, next slide. Then you want to think about the tool, again, in itself, in terms of sitting there with a client, how it's being used, thinking about the clinicians using it, and you want to think about what staff will be able to implement in a busy day and what will make sense to both the clinician and the client. So you want the tool to be clear. You want it to be specific. Ideally, you want it to be brief. You want it to ask clinically relevant questions and use a simple scoring system that's going to tell you meaningful information via the scores. You want it to be easily accessible, and again, back to what we were just talking about it. You want it to be based on research, and you want it to be psychometrically sound. Okay. So then, again, the tool is one piece of information, and it's a good piece of information, but you really want to use it in the context of all the information that you have, in the context of the discussion with your client. As Julie was speaking about in the example of Tiffany, this is really a tool for communication with the client. It's not something that you're worried about teaching to the tester, or there's some secret about it. You want this to be very, very transparent, and you want to be working toward what the client is saying. You want to understand what the challenges are for the client. You want to understand how the tool can be used to work toward how to understand the symptoms, to understand goals and objectives. You want to understand what symptoms and symptom improvement might look like. So, you know, what would it look like for us to move from a 4 to a 3 in this area? How could we work together to help think about, you know, helping you to address these symptoms and feel better? And again, you're using it to think about discharge planning and the end of treatment. Also, you're really reviewing as part of supervision to better understand both individual and caseload needs for the clinician. And I just want to note that all of this information from these last few slides about choosing tools, thank you, Kara, using outcome measures, we've put together on a handout, sort of a one-page handout that hopefully will be helpful. And then, again, to reiterate what Julie was saying earlier, in addition to using the outcomes tool and the outcomes information at an individual client level, you can also look at the information across an aggregate level. Looking at across your clinic, you can better understand the clinical population, the folks that you're serving, the symptoms they're coming in with. You can better understand outcomes over time, and needs of clients. And you can look at it in different ways. So you could look at it to understand outcomes across a particular diagnosis or across the different diagnoses that are being served in the clinic or in the clinic. You can look at it for across length of time in treatment. So, for example, you would expect that folks who are staying longer in treatment are coming in with higher symptom scores. So you can look at that. Does that hold true? Does it not hold true? What does it mean? Really, you're using it when you're thinking about it at an aggregate level. You're thinking about how do you use that information to inform the work that you're doing, to inform the services you're providing. And again, it's just another way to look at it is across groups with similar baseline scores. So if folks are coming in at around the same place, are they improving at about the same rate? Does that vary by diagnosis? Does that vary by other factors? Again, just different ways to look at the data and to look at the information that you have to make data be information, essentially. Okay. And so really to recap, the first step is thinking about the selection of the tool, identifying what tool you want to use, training both in, you need to provide training both around administration and scoring of the tool, as well as how to present that, how to discuss with clients so that clinicians and clients both feel comfortable with it. You implement it, and then it's part of ongoing training, discussion, and review so that it continues to help you get to that number D of consistently using and having that inform the work that's going on. And so this assessment tool rollout, these few steps can be worded another way in the next slide. It's just the plan, do, study, act cycle. So really, again, planning, understanding what you're looking to measure and choosing a tool, doing, implementing the tool, gathering the data, studying it, understanding what it's telling you, understanding the information you're receiving, and then using that data to facilitate communication to better inform the work that you're doing. Maybe you started choosing one way to look at the data or one type of outcomes data to look at, and you want to expand that. Maybe you want to refine it in some way, but again, always using the information to inform the work that you're doing. And somebody, one of my colleagues, retermed it as it's the same thing. It's assessment and reassessment ongoing. And so with that, I will turn it back over to Julie.
Thank you, Elizabeth. And before we start talking about the commonly used tools in the field, what we wanted to say is this is just some of the tools that we had looked at and have some familiarity with. And just as a caution, sometimes I get concerned that people, because they've sat in and participated in this webinar, that does not qualify one to utilize these tools. Each of the tools have different requirements in order to use them, so we're going to encourage you to make sure that you're following up and you're looking at what are the requirements, whether that's educational or experience level, and make sure that you really have that under your belt. So that being said, some commonly used tools in the field, and again, we're not going to spend a lot of time talking about all the different tools. So we have the Outcomes Questionnaire, the Beck Depression Inventory, the BAP2, and the CAGE AID. The CAGE AID is really a 4-question screen that has been recommended by OMH and OASAP in terms of giving you some information about somebody's drug or alcohol use. And it's, like I said, very simple, yes or no to 4 questions. We also have the Connors 3, the Pediatric Symptom Checklist, the PHQ-9, Strengths and Difficulties Questionnaire, and the YOK. And I wanted to show you this resource that we are going to have on the website that will be available for all you guys. It's a very nice 20-page booklet information packet about all different kinds of testing and tools out there that you could use with children. And I'm just going to show you a few of the pages. I'm going to try to make it a little bit bigger so we can see it. So it gives you the name of the instrument, a description, age range, time frame, scoring, psychometric information, and who it could be administered by. So this is a really nice resource that if you're interested in starting to use some outcome measures or some tools, this might be a nice resource for you. And again, it'll be posted on the website. And that brings us to maybe not so commonly used tool, although we may not think of it as a tool, but the idiosyncratic strating scale. And what you're really doing is you're working with an individual client, you're determining what exactly do you want to measure, whether it's a behavior or a symptom, and then you're figuring out how are you going to measure that. And I think that as clinicians, we have done this, maybe not as formally as pen and paper, but we do ask people, please pay attention to, if somebody had depression, please pay attention to the level of your depression over the next week and let me know how things are going. This is really asking you to make it a little bit more formalized so it could be useful. And so this is an example of a measure for Tiffany's week. Tiffany is the person we were talking about before. With the anxiety, she also had some school avoidance behavior. And what that meant is she was missing school or being late. Now, what I wanted to measure is I wanted to measure how many times she missed versus how many times she was late for school. And I also asked her to measure her level of anxiety on a scale from 0 to 10, with 10 being the highest. And so I just asked her to fill this in, her and her parents to fill this in, so we could get an understanding of how things are going with her. And so we would have her do this each week. And the reason I chose to separate out missed and tardy and didn't just put school avoidant behaviors, because to me those are two very different things. And if I had to choose, I'd prefer somebody to be a bit late rather than miss the whole day. So with that being said, I want to talk to you guys a little bit about the MAP system, Managing and Adapting Practice. It's a nice, easy-to-use program, and there's going to be an upcoming application if you're interested in participating in the MAP. And basically what the MAP system is, it gives you a bunch of different options to really help you use outcome measures and guides and really drill down to see whether what you're doing is effective or not, and to help you use evidence-based practices in an easy way. I know a lot of times I myself am guilty of this. I go to a training on something and it's an evidence-based practice and I'm all gung-ho about it, and then I get back to the office and I think, how do I do that here? And sometimes I get lost. And then also, not only how do I do that here, but how do my clinicians come back and use this evidence-based practice? And so with the MAP system, you can successfully measure the progress of a client in more than one area. And like I said, there's going to be an application to participate either with CTAC or EBTDC, and it'll be coming down the pike soon. So MAP, it's a PWeb. It's evidence-based literature. It's basically a database, but don't let that scare you, because a lot of times when I hear the term database or research and studies and evidence-based, I kind of lose interest a little bit because I don't know how I'm going to translate that into what I do. But basically, it's a really nice program, and what you can do is you go in, it has a database of evidence-based studies, and it helps you figure out with a specific symptom, what do most studies think is the most effective evidence-based practice. And it's like I said, very easy to use, and I'm going to show you some examples. So that's the P-Web. And so now this is what we have, and I'm showing you a screenshot of the system. And so if I were using this with Tiffany, I would select the anxiety, and I could also select, oh, you can't see it. There will be the suicidality as well, okay? So that's what I would do with Tiffany, and I could put in her age or her grade and different information. And then this is what it gives me. It shows me, according to the study, here's my problem type anxiety, grade 5, and then I wanted really strong evidence-based research studies. And so over here it gives me the practice elements. And what a practice element is those are the clinical interventions that you and I use every day when we're working with our clinicians. And I know for me, when I'm either working with somebody and I'm seeing them and we're working on anxiety and I want to do exposure, I want to make sure that I know exactly, in my head I know what exposure means. This program will really give you a step-by-step directions about really what exposure is according to evidence-based practices, because we have a little tendency to kind of, the further we get away from the training, the more I adapt that practice to be my own. And so it gives you the practitioner guides, and the practice guides really, like I said, give you the step-by-step evidence, the information on how you actually do it, and a process guide that provides a framework for clinicians to make decisions related to care and treatment. And so now this is the practice guide for anxiety, and it'll give you the objectives and the steps. And so there are practice guides for many of the different clinical interventions that we do. If you're a newer clinician, this could have been so great for me if I had it years ago. And I still think it's helpful for me now because, like I said, the further I get away from a training on a specific intervention, the more I make it my own, and kind of the more I make it my own, the less evidence-based it is. And I think it's really great if you're supervising newer clinicians as well. It also has clinical dashboards where you put in different pieces of data, numbers, and it's not, I always get nervous when people start talking about collecting data, but the way the system is set up, it really is very friendly to you. So you put in data elements which are displayed. It allows for the tracking of the individual's progress, and it also allows me to track what clinical interventions that I use. And this is what it would look like. So this truly is something that I created based on Tiffany's case. And so over here I'm looking at, on the right scale, I'm looking at average level of anxiety. And so we can see it going down. I'm also looking at school refusal days. How many days in a week did she miss? You see that number going down as well. And also tardy. You see the tardy goes up a little bit, which would make sense because her days of missing school have gone down, and then the tardy comes back down. On the bottom, it really tells you the different interventions that I use. And so I could have done engagement with the caregiver, engagement with the child. If we go to exposure, what might happen is if I had given a homework assignment for her to go and talk to somebody in her class, and she did, and the outcome was not as favorable as I had hoped. Let's say she had decided that she was going to talk to the head cheerleader and see if she wanted to come over to make cookies later. The head cheerleader may have other commitments and say no, and so the exposure may not have been as positive as I had hoped. So what I would need to do and spend the next session on really is getting back into the engagement and working on my relationship with the client. And really the practice guides really give you step-by-step guidance about how you can do those things and why it's so important. And so for me, this outcome measure and the MAP system is a very nice tool that you could utilize in clinical practice that really supports you looking at outcome measures, and not only for the individual client, but also for the clinician as a whole, then the clinic, and then if your agency has more than one clinic, it's a nice way for you to gather data in an easy way to really know if and what kind of impact you're having. And again, on the website are going to be the information related to some of the resources we spoke with you about and how important it is to make sure that you are looking at outcome measurement tools and clinical support tools. As we continue to go further and further into managed care, it's going to become even more important that we're demonstrating what a positive difference that we make. And I know that we all feel the positive difference when we work with somebody, and when somebody successfully completes, we get that oh yeah feeling. And really the use of outcome measures and clinical support tools really can help us show people who are interested in numbers the difference that we are making.
Okay. So shall I take us through sort of in summary? Thanks, Julie. And I think that was really helpful to sort of see it sort of live in terms of how you can use the outcomes, how it really does track the change over time, and how it's just a very visual and helpful thing for both clinician and client. So, you know, in summary, outcome measures are tools, whoops, thank you, that are used to assess change in clients over time in a way that informs collaborative decisions about treatment. They provide a means to objectively measure success or effectiveness of treatment. Again, they offer one piece of the whole, so it's just one more piece of information in understanding whether or not the right treatment is being provided at the right time, or you know, what other types of interventions might be useful, or helping to just facilitate that discussion with the client. And outcome measures provide data that is really necessary to be provided to funders, to payers, to demonstrate the effectiveness of services. Okay, and so with that, I will turn it back over to Kara to facilitate the questions and answers.
Thanks, Elizabeth, and thanks, Julie. As always, what you offer us is very, very helpful. We're now going to take some time to do some questions and answers that you can type in your chat box, any questions you have. I've already received a few questions about our resources and our slides, which will, again, be posted on the CTAC NY website either this afternoon or this evening or tomorrow morning. We have to download everything first, and then we upload it, so it takes some time. I did want to direct your attention to what Julie went over with everybody very briefly, which was the MAP system. In your inbox or your supervisor's inbox is going to be an application to join either one or two or both approaches offered to clinics. So there's one which is called the Practitioner Education and Decision Support Initiative Learning Community, which is through CTAC. That is one option, and this is going to be a little bit of a milder version of MAP. And then MAP is also going to be another option, which is going to be rolled out through the EBTDC. So just to highlight that for a moment and look for that in your inbox, and we hope that you can participate with us or EBTDC in the future. So does anybody have any questions for Julie and or Elizabeth? If so, please type them in the chat box, and they will answer as best as they can. And we also may put up some frequently asked questions on our website around outcome measures, because it is becoming such a useful concept these days in our work. If you have a question, you can type it in the chat box and send to all participants or panelists. That way we can all see the question. So Andrew asks, can you recommend standardized client satisfaction forms for parents for children? Elizabeth or Julie, can you recommend standardized client satisfaction forms for parents for children?
You know what? Sorry, go ahead, Elizabeth.
That's okay. That's okay. Go for it, Julie.
What I would say is there was, are we talking about client satisfaction with the services that they're receiving from the agency? I know that in the past Spectrum had used, it was like 7-page questionnaire to ascertain client satisfaction with services. And this year we went with a much shorter, and it is a valid and reliable instrument. I can find out the name of what we had used and get that for you, if that's what you're referring to.
Yeah, he says, to qualify, he says for parents and children he was asking for.
Mm-hmm.
Okay. So we'll get the name of that for you, Andrew, and put that on our website for you. And here's another great question. How does an agency start initiating an outcome measure? That's a great question.
So again, I think that the first thing to do would be really to identify what it is you're looking to measure. So again, if it's global symptomatology across the types of symptoms that folks generally come into the clinic with, if you want to focus on a very specific diagnosis first, or if you want to be diagnostic specific in terms of your outcome measures. So just really thinking through, it sounds whatever, but I would really just say taking through the plan, do, study, act cycle. So first really planning, thinking about what it is you're looking to do, identifying very, very clearly the specific things that you're looking to measure, selecting the outcomes tool, and then providing the training for staff around both implementation of the tool, how to understand what the tool is telling you, and how to discuss it with clients, and then how to use that information over time. So, I think this may sound sort of contrary, but I would say both to go through that process of plan, do, study, act, but also just to jump right in and to do it. So to think it through and to plan the implementation, and then at some point just to jump right in and start doing it. Sometimes it is easier to start with a pilot and to do a pilot first and to really implement it through a smaller group and understand how you're using the information, how the rollout works so that you can use it to inform a larger rollout. I'm not sure if that's helpful. Those are some different ways.
Very helpful, Elizabeth. Thank you. And kind of a follow-up question around that, but a different question is, how do you get staff buy-in for trying a measure?
Well, for me, I think if you would go back to the pilot, and who are you selecting in the pilot? When we started using some outcome measures, and when we really started looking at transitioning with the old OMH regs versus the new regs in the new world, we really created a lot of different pilots for different processes. And part of the pilot was really to get people who were really interested in outcome measures in this case, but I also wanted to balance that with somebody who is probably more typical of the average clinician, who wasn't necessarily really committed to outcome measures, who were more interested in doing traditional therapy and not with a lot of experience using outcome measures, and really to get a balance because if I just had a whole bunch of people who are really interested in outcome measures, then the pilot really would just tell me that all those people really like outcome measures, whereas if you have people, in some of our pilots, we had people who were actually against outcome measures, and I wanted to get their perspective as well, because that's the person who's really going to tell me about the glitches and the bumps, so I can fix it before I roll it out to the entire agency. So I think the pilot process is really important, and who's on that process and who's on that and how long does it run for. I think those are really important to me.
Thanks, Julie. That makes a lot of sense. I have another question from Linda Embry. She's asking, do you have a tool you recommend for global assessment for children 5 and over and 5 and under? So I think she's interested in a pre and a post test for kids, one for kids 5 and over and one for kids 5 and under, if you guys have any recommendations.
So I think there are a few that are out there. I really liked the tool, the tool that is up on the, or is going to be up on the CTAC website, which goes through a lot of different, very specific tools for children. I think I would again look through that to see if there's one that really gets at the specific areas. The thing about, particularly for children 5 and under, and really up until I would say 13, and probably with some tools a little bit older, you'll usually find tools that have a parent report, a teacher report, and a self-report. And I really do like tools that have the different reporters, because you can really look at how the different perspectives are around the symptoms. So you get a couple different. So I would vote for a tool that would give you multiple perspectives to be able to gather information with.
Thanks, Elizabeth. I have a question from Donna Ray, which I think I can answer. Will there be any form of pre and post test to measure the outcomes for the CTAC training 4Rs and 2Ss program? Donna Ray, we have outcome measures. We have ways to measure the actual curriculum with the pre and post test, but we don't really yet have a way to measure the training, so that's something we've been thinking about, and I'm glad you asked that. So we're working on something to really check in on whether our trainings are effective. One way we can do that is to see if fidelity, so we looked at fidelity in our learning community last year, but we don't really have a fidelity for our individual manual yet. We're using this opportunity to create one with our current learning collaborative. So for those of you that aren't aware of the 4Rs and 2Ss for Strengthening Families program, you can go to our CTAC website, and it's listed under the clinical trainings. We're currently having a learning collaborative with about 17 clinics throughout New York State, where we're implementing the individual family manual. So thanks, Donna Ray. We can talk privately about that as well. It's a really great question. And then to follow up, Andrew Malkoff, I hope I'm saying that correctly. He's telling us that he's in the process partnering with the University Research Department of standardizing scales for risk and danger and for adherence to treatment. And he's wanting to share this information with everyone. Thank you so much, Andrew. That would be wonderful. You can email that information to Jessica Rathel or myself, and we will distribute that on our CTAC website if possible. That's a really great offer. Thanks so much. Deborah says that these tools all look like they are for specific client diagnosis and not meant for use on all clients. Dr. Mark Reagan's practice at the Village in California uses the Milestones of Recovery Scale. I guess it's also called the MORs, an assessment tool to identify each client's progress towards their own recovery goals. Can you comment on the use of a broad-based tool versus a tool for specific diagnosis groups? Julie or Elizabeth?
Well, I think it depends what you want to measure and what are you hoping to get and how are you going to use your results.
Yeah, I would agree. I think there are pros and cons to both. If you really are trying to target in on very specific symptomatology, then I think clearly there's a benefit to being specific. If you're trying to sort of capture at a global level, there are tools, again, that are built around the types of symptoms that people generally come into outpatient mental health clinics with, and so to use one of those allows you to have sort of a broader brush, but then just recognizing that there may be some clients for whom it's not as relevant or specific, and that there may be some clients that you would need to use a different tool for.
Right, and what I would also say is I might see using a broad tool for somebody when they first come in at assessment and at discharge, just to figure out where you think that the areas of improvement or functional deficits are. But then I would think that during the course of that, when you figure out and you determine that it's depression or anxiety or disruptive behaviors, that it'd be appropriate to use those tools in the context of therapy to measure those symptoms in hopes that at discharge, that is also going to be, those tools in your clinical interventions also are going to impact their functioning at discharge, i.e. somebody comes in, they have a lot of functional deficits, a lot of symptoms, so we determine it's anxiety, so we start measuring anxiety throughout treatment, and then at the end it might be a good idea to get another global perspective of, okay, they came in at this score, now when they're discharged they're at this score. I think that would make sense to use that if you wanted to in that way.
Absolutely.
Thank you, Julie and Elizabeth. I think we have time for one more question. I have a question from someone who's saying that they want to start using outcome measures in a more meaningful way and are not sure how the best way to move forward with this in their clinic and agency. And they're wondering if you have any advice on a consultation around this. Do you know of anybody that can consult with them around these using outcome measures in a more meaningful way in their clinics?
For me, I would need to know a little bit more about that person's role and what they're hoping. Are they hoping just to use it for themselves in their practice? Or are they a supervisor and they're hoping to use it for the entire clinic? Or they're a director and they're hoping to use it for the entire agency? Because I think those are very different ways.
It seems like they're a director. I'm not sure. Yeah.
I mean, I wonder if this is one of those areas that CTAC might be able to delve a little bit deeper into. I'm not sure, but a question back for that we can bring back to the CTAC team. I think this is one of those that we can get more information on.
That's a great idea, Elizabeth. I was thinking the same thing. Okay. So I've collected these questions, and we're going to post some frequently asked questions on our website around outcome measures. And if you have any others, please feel free to email to myself or Jessica Rathel. We are going to conclude the webinar in 1 second. We just wanted to show you some resources that will be up as well from all of the measures that Julie and Elizabeth talked about today. And then upcoming CTAC events. So April 24th, from 12 to 1, we're going to have a webinar, a family partnership webinar with Mary Ackrey, Jerry Burton, Ann Cumpinger, and Sandra Staggers. And then in May, we're going to have Dr. Adele Diamond, who's a wonderful woman in British Columbia, but she's a Queens native. She's going to do a webinar for us on child development and the brain, promoting resilience and joy. So I hope that you can join us for either or both of those, and we hope that you have a wonderful day. Please fill out our feedback survey, and here is our contact information. There's Julie's email, there's Elizabeth's email, and there's my email as well as Justine Live. I hope you're all well and have a wonderful day, and we will see you in April. Take care, everyone.